Other than skin cancer, prostate cancer is the most common cancer among American men. About 1 in 9 men will be diagnosed with prostate cancer during his lifetime, so chances are you or someone you know will be impacted. In this video, I'll share some high-level information about prostate function and health, review some statistics, and at the very end, I'll share with you some findings on prostate enlargement and cancer that at the very least should encourage you to make sure that you have adequate vitamin D levels. Let's talk about men's health. Welcome and thanks for tuning in. My name is Marcus Bailey. My goal is to help as many people as possible not only take control of their health and well-being, but also give you tips and information to help make that health journey more enjoyable and easier to stick to long term. This video will give you some high-level information about the prostate, common prostate conditions men get, and some information that I hope will make you feel just a little bit more confident in your ability to take some actions to help reduce your chances of experiencing these conditions. Now, before we go on, I want to reinforce the disclaimer that you see down in the video description. This video is for information only and not intended to be a replacement of or a substitute for consulting your personal physician or specialist. If you are experiencing any symptoms or have concerns of any conditions, please visit your doctor as soon as you can. So, what is the prostate? The prostate is a small, soft organ. On average, it is roughly the size of a walnut or a ping pong ball, and it sits directly below a man's bladder. The prostate is not essential for life, but it is important for reproduction. It surrounds the top portion of the tube that drains the urine from the bladder, and its primary function is to produce the fluid that nourishes and transports sperm. What are some of the signs and symptoms you may experience that may prompt you to see your doctor? Since the prostate surrounds the urethra, you may often experience problems with urination or bladder control. Some of the issues could be poor bladder control, including frequent bathroom visits, urinary urgency, sometimes with only a small amount of urine, difficulty starting the urine stream or stopping and starting the stream while urinating, a weak or thin urine stream, blood in the urine or semen, painful or burning urination. I don't mention these for you to self-diagnose any condition, but for you to be aware that you should not dismiss the signals that something might be wrong. What are the most common prostate conditions men get? There are a few common medical conditions that men can experience with their prostate that I want to make sure that you are familiar with and able to share with others. Prostatitis is the swelling or inflammation of the prostate. As the name implies, the suffix itis means inflammation, like tendinitis, bronchitis, etc. Prostatitis often causes painful or difficult urination. As with most other acute cases of inflammation, sharp pain may be involved. It can also be a chronic or longer-term condition that lasts 3 months or more, so please don't ignore the signs. An enlarged prostate is very common, especially with men over the age of 50. This is referred to medically as benign prostatic hypertrophy, or BPH. Benign as in non-cancerous, prostatic as in prostate, and hypertrophy as in growth. In weightlifting, hypertrophy of your muscles is often the goal, getting bigger, but that's not the goal in the case of your prostate. When the prostate enlarges, it presses and pinches the urethra, narrowing the tube. That narrowing reduces the ability to empty the bladder and can ultimately lead to many other problems linked with this condition. Finally, prostate cancer. Cancer starts when cells in the body begin to grow out of control. Cells in nearly any part of the body can become cancer cells and can then spread to other areas of the body. This happens when cells undergo DNA changes that alter the way they function, especially how they grow and divide. Consequently, prostate cancer begins when cells in the prostate gland begin to grow out of control. Like other cancers, those changes can be based on what we inherit genetically. The National Cancer Institute says that inherited genetic mutations play a major role in about 5 to 10% of all cancer cases. The other causes arise during a person's lifetime as a result of errors that occur as cells divide or as a result of damaged DNA caused by certain environmental exposures. In other words, the conditions that we accidentally or intentionally subject our bodies to. The uncontrollable vegetable growth is why this is a very serious situation and why you shouldn't make any assumptions, self-diagnose, or put off routine testing and medical checkups. So what can men do to be proactive about prostate health? First and foremost, as I mentioned before, don't ignore any signs that something may be wrong. React and respond quickly to make sure that you and your doctor can detect and treat any condition as early as possible. That being said, there are a few things that studies show can be helpful to maintain prostate health, overall health, and potentially reduce your chances of having any prostate issues. Diet. It should come as no surprise that diet is one of the things that we can control to help maintain good health and reduce our chances of developing certain types of cancer. Knowing that genetics plays a role, as we said a moment ago, but also that environment and lifestyle play the other part, should urge us to be more careful about what we introduce into our body via dietary intake. It's unethical to develop a study where you have one group who's on a disease prevention diet versus another group who's on a disease-causing diet. So scientifically, it's hard to speak in absolutes about things that you should and should not eat or drink. But there are a few things that studies have shown that are worth discussing. First, studies show that most carcinogens that are ingested, such as nitrates, nitrosamines, pesticides, and dioxins, come from food, food additives, and cooking. As an example, charcoal cooking and/or smoke curing of meat produces harmful carbon compounds which have a strong cancerous effect. Saturated fatty acids, trans fatty acids, and refined sugars in flour present in most foods have also been associated with various types of cancers. Most recommendations for healthy choices point to a non-processed, real food diet that includes plenty of fruits, vegetables, leafy greens, especially cruciferous vegetables, and other whole foods that haven't been stripped of the antioxidants and nutrients that they're naturally found with. Remember, your organs, your cells, your tissues are like a chemistry set, reacting and responding to what you introduce them to. So we have a lot of influence over the negative or positive events that happen inside. Dairy. High intake of dairy products, including whole and low-fat milk and cheese, increase the risk for prostate issues, according to a 2015 meta-analysis in the American Journal of Clinical Nutrition. That and other studies talk about factors such as lactose, which affects calcium absorption and in turn affects calcium and vitamin D levels, both of which may affect prostate cancer risk. More to come on vitamin D in a moment. High dairy intake is also thought to promote prostate carcinogenesis by impacting hormone levels, testosterone, and estrogen balance, consequently activating pro-oncogenes and deactivating tumor suppressor genes. Dairy intake may also increase the growth and number of cancer cells through elevated insulin-like growth factor 1, or IGF-1. Now, as a side note, knowing that already prostate risk increases with age, these factors create an increased problem because there is a lot of marketing and money being used to get people to drink more milk, especially older people. Inflammation. Continuing to build on the first two, it's important that your diet, your supplements, and your activities contribute to an anti-inflammatory environment within your body. Here's a short list of do's and don'ts. I'll have a separate video dealing exclusively with inflammation, but these 4 things will be a good start. Number 1, reduce or eliminate vegetable oils. Vegetable oils are high in omega-6 fatty acids. Having an imbalance of omega-6 and 3 through processed foods and oils can lead to increased inflammation in the body and potentially contribute to disease. Number 2, adding in more turmeric. Turmeric is a spice that contains curcumin. Curcumin can decrease inflammation in diabetes, heart disease, inflammatory bowel disease, cancer, and in general. In one study specifically, when 80 people with solid cancerous tumors were given 150 milligrams of curcumin, most of their inflammatory markers decreased, much more than those in the control group. You may have already heard, but I'll reinforce, that if you are taking turmeric as a supplement, you should get the kind that includes black pepper for better absorption. Reduce or eliminate added sugar. Here we go again with the sugar. Let me explain how, once again, added sugar is not your friend. Processed foods, sugar-sweetened beverages, and other forms of added sugar and simple carbohydrates have been shown to cause chronic low-grade inflammation. This was measured through higher levels of an inflammatory marker produced by the liver called C-reactive protein. CRP is produced as a result of inflammation in the body. So, without getting too far down the science rabbit hole, even low levels of inflammation on a chronic basis can lead to disease. Add more exercise. Most of the time when you think about exercise, you might think of stressing out your muscles and being sore. But the dominant response from regular exercise is anti-inflammatory. Large studies have shown a relationship between regular exercise and reductions in low-grade chronic inflammation. Exercise also teaches our body to react better to stressors imposed on it. Training to reach a fitness goal typically involves a cycle of exercise-related stress, followed by recovery periods. So be careful not to confuse regular exercise for your health with overtraining or heavy lifting that someone else may be doing to prepare for a competition. So those are your 4 anti-inflammatory tips. Now we'll move on to the last proactive prostate health item you need to consider, and that's vitamin D. Vitamin D. I've gone through the basics of vitamin D in another video where I talk about the sources and some very key benefits of it. I'll link to that video at the end of this one, but I want to share a few more ways it's helpful, specifically around the subject of prostate cancer. This is based on low-grade and non-aggressive forms. And again, this is for your awareness and information only. First, if you remember earlier, we talked about cancer losing its sensitivity to growth inhibition. Basically, they are selfish and don't know when to stop eating and growing. Cancer cells also lose their sensitivity to apoptosis, or programmed cell death. So they don't know when to stop growing and they don't know when to die off. According to many published studies and medical literature, one of the things vitamin D does in the body is help to block the cell proliferation or out of control replication. It also helps to stimulate the natural apoptotic switch, or in other words, maintain the circle of life where cells die for the benefit of the rest of the body. Now, as it relates to prostate cancer, one of the main reasons why this information and these studies are available is because early detected and low-grade cases are often put on what's called active surveillance, which means your doctor may say no immediate action may be necessary, and they may have you come back in 6 months or a year. Based on the results of that new biopsy, they'll determine whether your situation is getting better or worse. Well, within that time, there were interventional studies done where some patients were left alone to normal behavior, and some were put on a specific dose of vitamin D3. So it's a unique opportunity to perform these kinds of tests to see what sort of impact a vitamin or drug has on a serious condition such as cancer. So based on the positive results of those interventional studies, and in addition to the inherent properties of vitamin D that we talked about, I refer back to my opening statement about vitamin D, where I just simply wanted to give you some context to help you consider how important it was to get adequate levels for yourself. So I'd like to wrap up by first saying that I hope that you are more informed and certainly more aware of the importance of prostate health for yourself, as well as your fathers, sons, uncle, brothers, or any other men in your life. I'd like to remind you that this video was for information only and not intended to replace the advice and direction of your personal physician. Finally, I wanted to reassure you that there are circumstances that we may be forced to deal with, but there are plenty of things that we can do every single day to create a healthy, strong, and more resilient environment within our bodies. If you found value in this video, please consider subscribing. Make sure that you're getting notifications so that you'll be aware when new content is made available. I hope to provide both timely inspiration and valuable information to allow as many people as possible to take control of their health and wellness. Share this video with any man in your life of any age, and check back for videos related to all aspects of your health: meals, movement, and mindset. Thanks for watching.